We here at Geisinger are always looking at what is the cutting edge ways to be able to not only deliver you the care that you need in the most convenient way, but also to think ahead of what are the things that we may expect as we get older. And so today we're going to be talking a little bit more about the patients who are getting care at 65 forward. So when we're seeing patients at 65 forward, and you have shared with us previously, a lot of times there's a conversation about sleep. Are there particular things that you're hearing that you're going, I wish I had more information about this because it would help me better direct their care?
There are, and I'm very thankful to be able to ask these questions to you today. One of the areas that we get to is we understand there is a sleep disturbance, and we get there. We understand maybe people can't get to sleep or can't stay asleep. And then we get to this inertia where we don't know what to do next.
Sure.
So as primary care physicians, we go through that stepwise approach of, the least harmful to introducing medications if needed,
Sure.
Sleep hygiene and so forth. And then we get to that medication support. And then we get to the, what do we do next?
Sure.
So really, after we work up all those chronic diseases that could be causing problems with sleep, and we've stabilized those, what should be my next step? When should I be sending your way? Or is there any testing I could do before we get to you, knowing how precious the resource is?
Yeah, so I think one of the things that I'm hearing you say is what is sleep health and what are the expected changes with age? And so this is such an important question because we know there's what we call the normal ontogeny of sleep. That is fancy medical terms for saying that we know that there's an expected evolution of not only your duration of sleep, the number of hours you need of sleep, the consolidation of sleep, going from little babies who are napping and then having some nighttime sleep to a consolidation of nighttime sleep, and even changes in the circadian expression, meaning what time of day are we expecting to nap? One of the things that we know as we're getting older is that the duration of sleep does tend to change. So in the typical adult between 18 and 64, we generally are saying 7 to 9 hours of sleep. After we get to 65, we start seeing that even become a little bit shorter, and it's really 7 to 8. Although there are some adults who maybe it's a little bit less, but we usually are saying 7 to 8 is where we're trying to hit. However, we also are starting to see that there tends to be this fragmentation again, where adults who are past 65, we may start seeing this reemergence of daytime napping. Sometimes this daytime napping is a consequence of that I don't have anything else that I'm obligated to anymore because I'm retired. So I've lost those circadian cues. Other times it could be compensatory to medical issues or otherwise. The final piece that we very frequently see is also this shift in circadian phase. So we always talk about kind of those early dinners, and many times people are going to start going to bed very, very early, and then they're waking up very, very early. And so when you look at that summation of all those different types of expected changes, they really are representing what we're evaluating for in terms of sleep health in general, which is what is your duration of sleep? What is your quality of sleep? What is your timing and regularity of sleep? And then what is your daytime performance like? Any dysfunction in any of those are a call to action to have a further evaluation of, is there something that can be intervened on? It's important to recognize that there are over 70 different types of sleep disorders that are recognized by the International Classification of Sleep Disorders, Edition 3, text revision. And so with that, it really is not a matter, I would say, of the responsibility of primary care to say, I always need to name it. It's more of packaging it. Is it the quality problem? Is it a timing problem? Is it a duration problem? Is it a regularity problem? Is the person's sleepiness falling inappropriately asleep during the day? That can help and start creating some context around what are the specific categories we should now be directing that on. The question that very frequently people will ask is, why does it matter? Can I get away with less sleep? Is this so impactful? Well, the reality is that for the primary care, this does need to be the foundation that you're building on, because we know that when you're having inadequate duration of sleep, quality, timing of sleep, it's associated with an increased risk for all-cause mortality. And so it is a tool to optimizing all those medical needs that you have on a daily basis. And so it does become really important that if you are experiencing these sleep problems, and if you're seeing someone at 65 forward or anyone else within Geisinger, being able to help in partnering by giving some summaries of what it is that you're experiencing on a night-to-night basis. Start with keeping some progress of what you're doing. So what time are you going to bed? How long is it taking you to fall asleep? What time are you waking up? Are you waking up frequently in the night? What's causing you to wake up in the night? And then how do you feel when you're waking up? Are you waking up tired or are you feeling refreshed? Some of these can be important factors to help in directing your care. It also gives us a foundation to say, this is our starting point. Can we see progress from where you're at?